Dr. Martínez is a staff specialist doctor since 2018 at the stone disease unit in one of the hospitals in Spain. Currently, is a staff specialist doctor disease unit in Barcelona, Spain. Performed workshops as a professor, PCN, RIRS, stone disease, surgical treatment, various centers. He has a great interest in HOLEP RS workshop, which he has run in. He is accredited with the European Association of Urology, and his talk is sponsored by CC Pharmaceuticals. Welcome, Dr. Martínez.
Good morning. First of all, I would like to thank the organizer for inviting me to this talk and all the colleagues who are attending in this room. We are going to talk about the medical treatment and prevention of kidney stones, and we will talk about inhibitors like Phytate or Citrate. And this is important because nowadays we have new improvements. Every year we have new developments for surgical treatment for this disease, for kidney stones. But the prevalence of this disease is increasing in the last decade. It means also an increase in the healthcare system cost, but it also means a decrease in the quality of life of our patients, and also a decrease in the expectancy and the life expectancy of our patient, because we already know that those patients who has a recurrent disease, who are recurrent stone former, will have 2 times more risk of end-stage renal disease. So the target should be to prevent new episodes in those patients who has recurrent kidney stone formation. According to the different steps that happens when a kidney stone is being developed, we can modify 4 factors in order to reduce the risk of new stones. The main 3 factors are concentration, the concentration of different elements, the urinary pH, and the concentration of inhibitors that try to avoid the development of a kidney stones. There are different types of kidney stones, but if we focus the treatment in the main ones, which are calcium stones, we usually use 2 drugs, thiazide, in order to reduce the most frequently abnormality we find in the 24-hour test, which is hypercalciuria. And the second drug we mostly use is potassium citrate, which is the drug that try to increase the concentration of this inhibitor in the urine, which is the second abnormality we usually find in calcium stone former, hypocitraturia. So we are trying to focus the talk in inhibitors. Firstly, we are going to talk about the more studied one, which is citrate. Citrate is a weak organic acid. We can increase the concentration in our urine of citrate if we increase in our diet citrus fruits, but we have to increase a really huge quantity of citrus fruit in order to achieve the same concentration if we compare it with dietary supplementation. So we usually use citrate salts like potassium citrate in order to increase its concentration. And it is excreted in the urine, and it is interesting because it works as a chelator of calcium, so it reduces the concentration of calcium in the urine, but it also reduces the nucleation, the aggregation, and the growth of new crystals. So it is a potent inhibitor of calcium stone development. But which evidence do we have to say that? There is only just one randomized controlled clinic published in 1993 in which compare potassium citrate with placebo in calcium stone former, but in those patients who has hypocitraturia. And there was a significantly reduction in the number of episodes after 36 months of follow-up. So in this concrete group of patients, we will find a benefit if we use potassium citrate in those patients with calcium stone who has hypocitraturia. On the other hand, we have to keep in mind that after those studies, we have now evidence enough to say that potassium magnesium citrate is even more potent and more powerful than potassium citrate. So if we are thinking in giving our patient supplements of potassium citrate because they have hypocitraturia, we should also be thinking in using potassium magnesium citrate in order to have even more benefits for our patient. But what is the main problem when we try to prevent new episodes? There are treatment limitations because there are patients who have side effects or contraindication for the use of potassium citrate. They can have gastrointestinal discomfort when they take those pills. They can have chronic kidney disease, and we can use potassium citrate because of the risk of potassium, or even we cannot use potassium citrate if we have also infected stone associated with calcium stone. But also there are patients in which we have a completely normal metabolic study, or even we are treating them, we are using pharmacological treatment, they have also recurrence. So what can we do in those patients in which we have correct their metabolic abnormality, or we don't find any abnormality in the metabolic workout, or they do not tolerate the treatment? Well, that's why it's so important now to talk about phytate. Phytate is a phytic acid. It is present in the skin of cereals and legumes, and it is a chelator of different ions like calcium. And it is interesting because close to 100 years ago, it has been studied the link of phytic acid and bone disease. But in the 70s, there were also studies trying to find if it could be useful, the use of phytic acid in those diseases where there was precipitation of calcium precipitation in tissues, like vascular calcification or kidney stones. And nowadays, we know that it is a potent inhibitor of calcium precipitation with no risk for bone disease. And why can we say that? Well, the first hypothesis was said by Dr. Modlin in 1918, who hypothesized that those patients who has a rich diet in phytate has a lower risk of kidney stones. And it was shown and it was demonstrated in 2004 in the huge nurse health study 2 with more than 90,000 women, in which it was shown that a diet rich in phytate has a significantly reduction in the risk of kidney stones. Those women who has a richer diet in phytate has lower risk of developing this disease. That's why some groups, like the group of Dr. Graces in Spain, are trying to see if it could be a pharmacological treatment or a treatment in order to prevent new episode of kidney stones. And it's very interesting because they saw that if we use dietary supplements in order to increase the concentration of phytate, it increases in healthy and in kidney stone formers. And in the lab, it has been shown that with this study of SO in 2007, that phytate reduce the saturation of calcium, reduce crystal formation, and reduce crystal growth. So it could be a potent treatment in order to reduce the recurrence in calcium stone formers. Why? Because phytate seems to act in all the steps in the development of a kidney stone, in saturation, in nucleation, in aggregation, and in growth. And up to my knowledge, this is the first study addressing this point. It has been published 1 month ago in the Spanish Association of Urology meeting. And in this study, in calcium stone formers with hypercalciuria that were used 380 milligrams of phytate every day for 3 months, there has been a significantly reduction in the concentration on calcium when we compare with the placebo group. But also, and this is very interesting, there was a reduction in cross-lab parameters. So this study suggests that we reduce the risk of kidney stone formation and also increase the bone health of those patients. And we also know that patients with kidney stone has an increased risk of osteopenia and osteoporosis. So it is very interesting because it seems that it can be a really powerful weapon in order to reduce the risk of kidney stone and also to increase the bone health. So as a conclusion, we have to keep in mind that there is a really important increase in prevalence in the last decades in kidney stone, that we have very limited treatment in order to reduce this prevalence. And nowadays we know that those patients which a richer diet in phytate has less risk of kidney stone. And if we supplement the diet of those patients with kidney stone, we can increase the concentration of phytic acid in the urine, and we can reduce the concentration of calcium in this urine. So probably we will reduce the risk of new episode of clinical kidney stone. Thank you very much.